Security employees have one kind of mantra they go through all the time is getting the right check to the right person at the right time. So we're going to talk about a couple of those, I guess all of those, because you're listening to this channel today. So we're going to go over some things, particularly now with the low staffing Social Security has, that a lot of people are missing benefits, not getting the benefits they earned, they need, because of the shortness of the staff across all offices throughout the country. So, all right. So I'm going to go through that today, and this is also a live Q&A. So it looks like I've already got a bunch of questions lined up there. So I'm going to try to answer as many as I possibly can for the rest of the hour. If you have any questions on disability, survivor benefits, spouse benefits, you're getting the right check or anything like that, make sure you type your question into chat or subscribe and all that kind of good stuff so we can get your questions later if need be. Okay, let's show the chart here real quick. This came out last year, and it's talking about there's this phenomenon you call the baby boomers. 1946 to 1964, over 70 million people born, and guess what? If they're lucky, they are getting old and they're retiring. So this is what we see happening here. So the gray bar lines up there are the millions of beneficiaries that are receiving Social Security benefits. We're talking over 70 million people that are receiving Social Security, retirement, disability, survivor benefits, spouse benefits, or whatever. And those people, when they need to file for those benefits, if they have issues, they get overpayments, they work, whatever the case may be, they need Social Security employees there at their local office to talk to help them get the benefits, get the right person, the right check at the right time. But this is, you can see the red line there. That's the number of staff. It is at a 50-year low. And this was even before Doge and started going in there and voluntold a whole bunch of people just to leave the premises, essentially. So we're talking about another 5, 6, 7,000 people down. So I'm sure I don't have to tell you, when you call into Social Security, you have a 3-hour wait, and then they just might hang up on you. The system automatically hangs up on you. And so unfortunately, there's not a lot of help at the Social Security offices. That's, I would argue, if you're a regular viewer, that's how politicians, because this is all politicians that are doing this. I would argue that this is part of their plan to destroy customer service, have you hate Social Security, and that way they can give it over to their sponsors, their billionaire buddies on Wall Street, so they can privatize it. So, so this has been a long time process, and they're succeeding. They're doing a pretty good job at that, but we're paying for it. All right, so let's get back to the regular story about getting the right check at the right time. I've talked many times about getting the right check. Let's talk about timing of that. There is a thing called protective filing, and this is kind of an insider, kind of not necessarily secret, but a lot of people don't know about it. It's protective filing. So when you first call Social Security, you're protected for a filing. So let's say you're going to file for retirement and you want it to start, in a couple of months, right? Or let's say you want to start it this month in April. Okay, I want my benefits. It's the end of April here. I want my benefits to start this month. If you call now today, because it's still April, even if you get your appointment next month or 2 months, which is probably the case nowadays, you're still protected. Your filing date is protected to April because that's when you first contacted Social Security. So 2 months later, when you actually get your appointment and actually talk to a human being at Social Security and file for retirement or disability or survivor benefits or spouse benefits or whatever the case may be, you can say, oh yeah, by the way, I want this backdated to April because that's when I called y'all. So protective filing is extremely, extremely important. So if you're coming towards the end of the month and you're saying, well, I'll just, I tried to call, but I couldn't get in or whatever the case may be, I always tell people, the regular viewers to my channel know that you keep a record of that call. You take a little screenshot of your phone that you were on that phone, or you jot it down and say, hey, I called Social Security on April 27th at 3:05 p.m. West Coast time, and I was on hold for 3 hours, and then they shut me off. And then I couldn't get in until May 1st, the following month. But I attempted to call in April. So they should protect you back into April. And in terms of getting documents, I see too many people not getting the right check at the right time because they delay. They say, common one is disability. Oh, well, I'm going to have a doctor's appointment next month, so let's go ahead and see what the doctor, get the medical documents for there. And no, 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 file. Oh, I need to wait until I get my medical records from this other place, or I need to do this, that, and the other. No, file for benefits, particularly disability benefits, because now, before the massive cuts, we're talking about 6 to 9 months to get your disability approved, the first level, or a decision, the first level. Now, 6 to 9 months if you're lucky. So don't wait. File, start the process, and then start getting your documents. And this is the same for across the board. If you're filing for divorce spouse benefits, I hear people all the time, well, I requested my marriage certificate and my divorce decree. When I get that, then I will call Social Security. No, don't do it that way. Do it opposite. Call Social Security, set up an appointment, because again, the appointment won't be for another month or two anyway, probably. And then even if you want to go ahead and do it online, if you want to do this online, go ahead and do it online. You can't do survivor benefits online, but you can do the others. But start it, even if you don't have your documents, because again, you don't want to lose that month or 2 months. So you go ahead and start the process. And then let's say you have a phone appointment next month or the month after. If you didn't get the documents you think you need, and again, Social Security, they will tell you if you actually need a marriage certificate or divorce decree or a death certificate or whatever the case may be, they'll tell you at that time. But if you think you might need it, go ahead and start getting it. But if your appointment comes up and you say, well, I still haven't got my divorce decree, don't worry about it. Keep the appointment. And then tell them at that time, hey, I didn't get my divorce decree. And maybe they say, oh, you don't need it. Your ex already filed and they mentioned you as a ex-spouse and that you were married 10 years. So you don't even need the divorce decree or something like that. So that they could use that in an existing claim. So you might not even need it. So keep the appointments. Don't wait for your documents. If you don't get your documents by that time, then again, they might be able to, accept, that your other spouse or whoever already filed, but they might just say, okay, all right, no problem. I'll go ahead and keep your claim open and go ahead and get your marriage certificate and divorce decree. It should come within a couple of weeks or something like that. And they'll just go ahead and keep your claim open. So keep the appointment and then make sure you tell them that, hey, by the way, I did call y'all 2 months ago and you didn't pick up the phone. And they should give you a protective filing back until that time. So this is a kind of a insider trick, I guess, that has pertained all the time, but it's even more important that you, your family, friends, anybody you reach out to them and tell them this, because it's 10 times worse because of the low number of staff at Social Security and kind of the craziness that's going on with everything. So a lot more people are going to lose benefits because they are not able to get in. Okay, what about Medicare? Medicare, same type of situation because of the low staffing. There's going to be a lot of people that are in kind of a special enrollment period. Usually when you file for Medicare Part A and Part B, you do that at 65. But if you have health insurance from current work, yours or your spouse's, and your employer has 20 or more employees, then you don't have to sign up. So let's say you delay and you sign up for Part B when you're 70 years old, or Part A and Part B when you're 70 years old. So what happens is you need a couple of forms from one from your employer that says, yes, this person had health insurance from work since they were 65. Don't penalize them to 10% for every 12 months, yada, yada, yada. That's okay if you can plan. If you know you're going to stop working, 1 or 2 or 3 months in ahead, then start the process. But I'm seeing a lot of people that their employers shut down, or the big one in Las Vegas, people are losing their jobs because the Canadians are boycotting. So people lose their health insurance immediately. And it's the end of the month and they're like, oh, I need to go ahead and sign up for Part B, but I can't get into the local office. I can't send in my forms. I can't do this. So they're going without health insurance for a month or 2 months. And therefore they're not being able to see their doctor, not able to get their prescriptions. And it's causing kind of a nightmare. The solution to all this is, better customer service. And who dictates what customer service is at the Social Security Administration? Your politicians. So make sure you reach out to your politicians. And another kind of issue with this, the right check. Let me talk a little bit about the right check. Is because Social Security offices are, just barely treading water now. They're not able to do some of the stuff that they need to do in terms of, actually finding fraud. Doge hasn't found any fraud whatsoever at Social Security, but Social Security employees find it every single day. But because they're barely, scraping by, barely trading water, they're not able to do that. And they're also not able to help people get the benefits. And particularly if you're getting the WIB-RIB, it's called widow's insurance benefits. I see a lot of people. There was a person, I think yesterday, that during my live Q&A, was receiving widow's benefits, and it looks like they were probably going to be able to get more as on their own record, switching to retirement benefits on their own record, but unfortunately not able to get in. Social Security is actually supposed to reach out to you when that happens. When your benefit amount on your own record is more, they're supposed to send you a letter. But again, a lot of that is being missed, and it's more difficult to get your benefits because of all the chaos out there. Okay. So that is protective filing. So whenever you get your actual appointment, if you file online or whatever the case may be, make sure you tell the claim specialist that's at Social Security, the employee at Social Security, that says, oh yeah, by the way, I also want my check to begin when I called or when I attempted to call a month ago or 2 months ago or 3 months ago. I've seen protective filing going back to 2 years. A homeless person went into a local Social Security office 2 years prior, didn't get their service. And yeah, then we found that person and said, wait a second, are you telling us you went into another office? Luckily, it wasn't our office. It was another office I will not mention, 2 years ago, and they weren't able to help you? Yes. And so we were able to give them back pay for 2 years because of that protective filing. So it's very, very, very important. All right, let's get into some of your questions here, and we'll have about 50 minutes. I'll answer as many as I possibly can here. Vic and Cynthia. I was a Chicago City Hall employee for 7 years. Do I qualify for the Social Security Fairness Act benefit? Okay, so if your Social Security benefit right now is being WEPT, the windfall elimination provision, then because of a non-covered pension, I think Chicago doesn't pay into Social Security. So you would, members of that, if they work there long enough, but it's based on whether your current pension from Social Security is being WEPT. So if you don't know, you probably should know by now that your benefit is being recalculated because of that non-covered pension. If when you filed for benefits, did they ask you to get a WEP letter? And a WEP letter is they basically said, hey, okay, we need a letter from the city of Chicago of when you were first entitled to that non-covered pension, when you were first eligible for that non-covered pension. Those are two different things. And how much that non-covered pension is on a monthly basis. If you provided that WEP letter, then yes, you are WEPT. And yes, the Social Security Fairness Act does apply to you. So let's see what else here. We've got Dr. Ed, started retirement benefit in January of 2025. I received a paycheck in January for work done in 2024. Will these 24 wages count against my earning limit for 2025? Yes and no, William. No, technically, but effectively, yes, but you can get it fixed. Okay, what do I mean there? Did I confuse you? You're welcome. Anyway, because Social Security doesn't know anything about that yet. Because you next year when your W-2 is produced or you file your taxes or whatever the case may be, then Social Security gets your amount that you made for the previous year for this year. And then it looks and says, hey, did you make over, if you're under your full retirement age, is this over $23,400? And if it's over $23,400 because of that one check, then they'll send you an overpayment notice that says, hey, you said you were going to stay under the 23,400, but you didn't, because the computer doesn't recognize it's for a previous pay, that your employer owed you money. So usually what you have to do is just go down to the local Social Security Administration with that proof and says, yes, 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 yes. I stayed under the 23,400, but I did receive a remaining check for the previous year. It wasn't because of work in 2025. It was work in 2024. They just owed it to me. So they should be able to take it off the books and, delete your overpayments. My wife spouse benefits were suspended January. We sent the updated SSA Form 7162 in February to the U.S. Embassy, Manila, but her benefits still have not been restored yet. So that's, the proof of life benefits when you're living overseas, because, there's like in the 50 states and in CONUS, continental U.S. and Hawaii and Alaska, Social Security, gets state, it interacts with the state database when somebody passes, the coroner or the funeral home or whatever passes it to the state, and the state tells Social Security, and Social Security tells the Department of Treasury and all that kind of good stuff. But if you're living overseas, the other hundreds of countries throughout the world don't have that type of relationship with Social Security. So that's why they send out this proof of life form, basically I'm not dead form. And so their benefits are suspended. And because of the staffing, and even more so at back in Baltimore, where this is being processed, the Office of International Operations, it's staffing. It just unfortunately have to wait. Or you can contact your politician and say, hey, I need my check. Whatever district you are from back in the United States, contact your politician, because if you're living overseas and you're a citizen, then you're still paying American taxes, right? So contact your politician and do a congressional and say, hey, I'm a U.S. citizen, or green card holder, whatever the case may be. I'm legally allowed to get these benefits. I just happen to choose to live overseas, and it's none of your business, but I want my check that I earned and I need. And so do a congressional there. If you go onto the congressional websites, they all have a little button there where you push and it says, I need help with a federal agency. And that's what you do. And they might be able to expedite it for you. But unfortunately, this is par for the course. And it's making it difficult to get your benefits. Took my Social Security at 62, now 68, ex-spouse, married 13 years, turned 62 this year. Am I eligible for spouse benefits? It sounds so potentially. So you have to file for benefits on your own record because you're 62. So you file for benefits on your own record. And when your ex turns 62, then you are might be eligible for benefits on that person's record, even if they haven't filed yet. It's called independently entitled divorced spouse benefits. You had to be divorced for 2 years, and your benefit amount has to be less than half of theirs. So go ahead and when you file for benefits at 62 here. Oh wait, you're 68. I'm sorry. So you're already 68. So I would contact Social Security now, and because it's going to take forever for you to get in, I would contact Social Security and say, hey, my ex is going to be filing here pretty soon, or it doesn't matter if they file. My ex is going to be 62 here pretty soon. Am I eligible for any more benefits? And then they'll look at your record, how much your full benefit amount is. They'll look at that person's record. You need the Social Security number. If you don't have their Social Security number, no problem. Just give them the name, the date of birth, as well as it, the city and state, as well as where they were born, and they'll be able to find the person's Social Security number, and they'll look at that person's benefit amount. And if yours is less than half of that person's, you're eligible for benefits. And then they'll tell you, in June or July or August, when that person turns 62, they have to be 62 the entire month. But when they turn 62, then they'll tell you to file for benefits and get there more money. And that's a beautiful thing. And the follow-up, and would I be eligible for half of full benefits? Yes, because you're 68 years old. Yep. It doesn't matter how old your ex is. It's based on how old you are. So because you're 68 past your full retirement age, then yes, you will get 50% of their full benefit minus your own. Please hit the like button. Thank you. Yes, James, thank you very much thank you. Thank you. That's how we get this information out there. Too many people are not receiving the benefits they need. Could you please explain for us how Social Security is funded separately from the U.S. budget? but why they keep saying that the only way to save the U.S. debt is to do away with Social Security, because they're trying to trick you. They think we're stupid. Yeah, there's a video by Reagan circulating now that he says, yeah, Social Security has nothing to do. Social Security is separately funded, has nothing to do with debt. Social Security is actually in the black. $2.6 trillion. That money is slowly being depleted every year. If you're getting a Social Security check, you're getting part of that $2.6 trillion. And as more baby boomers retire, more of that money is going to go out. And that's the issue, that Social Security, that trust fund is going to be depleted, just like any savings account. You have a savings account for retirement, it ain't going to last forever. And the trust fund ain't going to last forever. And we're looking at about 2033 or so, it's going to be down to zero. And then that's when everybody gets budget cuts, or cuts to their check. So politicians like to distract people. They say, the money was stolen, and that will shut you up for a while, because you call them up and say, hey, I don't want to get cuts in the future. What are you doing to fix it? And they say, well, it's been stolen. I'm still looking for it. They've been saying that for decades. We're still looking for that money. You got their big magnifying glass out there. We're still looking for that trust fund. Come on, you've been looking for it supposedly for 20 years. And guess what? It's not lost. It's in people's paychecks. And then they say, well, it'd be okay if we didn't give it to people that are not entitled to it, which, Social Security has a inaccurate pay rate of under 1%. That's pretty awesome. Social Security has passed all 31 audits over the last 30 years. So, and so this is another one. They say, we've got $39 trillion in debt, so we need Social Security money, but that's separately funded. That is not the pool that they need to pay the debt. So politicians basically think we're stupid. On SSI, not SSA, and having trouble finding how to report income. So if you're on SSI, yes, you definitely need to make sure really need to make sure you report your income. There's a phone system that it's a nightmare. I've tried it a few times just to see how it works when I was running the office, and that's just got to push all these buttons. If you push one button incorrectly through the process, you got to it's a nightmare. You can do it online. You can send in your pay stubs, fax in your pay stubs. And when you fax in your pay stubs, make sure you use a fax. Yes, there are still faxes out there that uses a confirmation receipt that, you go down to, whatever office store, and you fax it in, and then you ask them for the confirmation receipt, and that'll show that the fax actually went through, and that'll be your proof. And then when it gets to your local Social Security office, then it'll go into a paperless system that, by the way, I helped design, so I know that works. But the problem is, even if you fax those in, there's not people on the other side to pull those out of the system. It's called WorkTrack, and pull them out of the system and work it so you don't get overpaid or underpaid. And that's the problem. So probably you are either going to get an overpayment or an underpayment because you haven't reported your wages. And I know it's not your fault. You've been trying to, but Social Security, they don't have the staff there to help you, unfortunately. So again, another reach out to your politicians. So if you have an overpayment, then that's going to bind you up in the future. And this is another reason why, Social Security needs employees at the local office, because these things, people need help. People need help. So, call Social Security, set up an appointment. That's probably your best. To go down to the office. I would probably, I would go down to the office and take your pay stubs with you. And when the Social Security guards are not Social Security employees. They work for Federal Protective Services, so they're contracted guards. So they don't know anything about Social Security, but tell them that this is a dire need, or that this is a congressional issue. And how do you make a congressional issue? Before you go down there, go on to your local congressperson's, your federal politician, go onto their website and say, you need to do something about customer service. I've been trying to report my wages so I don't get an overpayment or underpayment. And what the heck are you doing? Don't give me all this BS about I'm still looking for the trust fund or, whatever. And therefore, as soon as you press that submit button, it becomes a congressional. So when you go down to the local Social Security office and the guard says, "Do you have an appointment?" You go, "No, I don't have an appointment, but this is a congressional issue." And then the guard is supposed to be able to, it's supposed to let you in. If they don't, then yeah, that's a big issue. So tell them it's a dire need or whatever. Yeah, they're supposed to let you in that particular case, because Social Security policy is, if it's a congressional dire need, Terry case, it's a terminal illness for a disability or something like that, you're about to be evicted or something like that, then they're supposed to let you in. So you really need to get in and get that addressed. Let's see here. I'm jumping around here with the questions since we've got so many, but who can I talk to that is very knowledgeable about certain Social Security scenarios? Talking to them will not help, as they can only supply certain info. Yeah, Social Security employees. I used to do one-on-one appointments with people. I don't do that anymore, but I found someone that just recently retired from Social Security after working there for decades, and she can help. So in the description, my YouTube video, you can look in there and schedule an appointment with her, Mai Jackson, and she can help you out. We do charge for those. Got to pay for the, electricity and, all that stuff. So 99.9% of our help is free, but in that particular case, unfortunately, we have to charge. Does the earnings limit rule apply for wages before starting Social Security? No. Under FRA, if I work January, April, and made 40K, retire in July at 65, and file for Social Security, still collect full monthly benefits? Yes. So the months before you start your Social Security benefits, Social Security doesn't care. So if you made $1 billion from January till April, but you're actually going to start your benefits in May, then they don't care that you made $1 billion before you started your benefits. You just tell them, "Yep, I made $1 billion last month, but this month I'm going to stay under the monthly limit, which is $1,950 for 2025. So as long as you stay under the $1,950 every month for the rest of the year, you are good. Nothing, nothing about the previous. You are an amazing person. Oh, thank you. Appreciate it. Thank you. Vince, I'm getting mixed info on how much money you can make on SSI, not SSI. Yeah, it's pretty much every penny, there's a $20 exclusion, but anything after that in terms of earnings, it will offset your benefit amount from SSI. So yes. Taken, hey, what's up, Taken? News today, Doge activity will cost taxpayers $135 million minimum. Lawsuits, rehires, new trainees, after only saving $150 million. Yes, I kind of said that from the beginning, because particularly I try to stay in my lane in terms of Social Security. All the people that I've talked to that were kind of forced out of the agency, a lot of them didn't want to leave and don't want to leave. But they were kind of, as we used to say in the Marine Corps, voluntold to leave, voluntary voluntary order, I guess. So some of those people are, particularly, the new employees that were hired and, committed their lives to working at Social Security. And then they were summarily discharged because of, they weren't doing a good job, even though they were doing a phenomenal job, in terms of their, training and everything. And I said, that's, they're going to get a lot of lawsuits. They're going to have to hire these people back. And it's actually this whole thing is going to cost money more than it, supposedly saved. Yeah. So, okay, let's see here. We'll skip that one. Paid FICA for over 50 years. Now I retire and have to pay taxes on the same money because I decided to continue working part-time. Didn't recognize that and got a huge tax bill. Thanks for what you do. All right, so let's see. You're paid FICA. Now I retire and have to pay taxes. That started in the 1980s as part of the attempt, in the 1980s, they say, hey, Social Security with all these baby boomers, we're going to need to shore up and, build up the trust fund. And one thing they do to build up the trust fund is to tax Social Security, which I personally disagree with. Shouldn't have to tax Social Security benefits. President Trump agrees, shouldn't have to tax Social Security benefits. I don't think it's going to happen. I don't think they're going to pass it. It doesn't look like they've got that anywhere in their sights that they're going to stop that. If they do, then it's not going to, 40-50% of people don't even pay taxes on their Social Security benefits. It's not going to help them. It's actually going to hurt them. It always helps the most vulnerable and poor, unfortunately. It always hurts, because then the trust fund runs out early, because that money that you pay into Social Security taxes, it goes into the trust fund. It doesn't go into regular Social Security tax or into IRS taxes. It goes into the trust fund. In terms of, I think they should get rid of it as well. Red squirrel. I don't think they should tax Social Security. But again, because they do that, about 50, 60 billion dollars goes into Social Security coffers, goes into the trust fund. So if they stop taxing it, then they're going to have to find that extra money. But let's see here. Sometimes on the weekends, the Social Security Administration online hours are not up specific times in the weekends. Yeah, my Social Security, sometimes they've got, down for maintenance and stuff like that. That's always been a kind of a fact. So I don't blame, the current administration or DOJ or anything like that. But yeah, the computer system has gone down more in the last few months than it ever did before. And the people that were kind of, keeping that system together, have been voluntold to leave. Elizabeth, do you think protective filing would go away with this current administration? Probably not. No, probably not. Number one is they don't know about it. And I think there's a lot of other places that they want to get rid of, filing, people get on disability and, there's, spouse benefits if you've been married 2 or 3 times and choosing the higher spouse. But on protective filing, no, I don't, number one, most people don't even know about it. And yeah, so, shh. Will my disabled son collect off me when I retire? Will he be eligible for Medicare right away? So if you have a child that's under the age of 18 and you start receiving as the parent retirement benefits or disability benefits, or you pass away, then yes, your children under the age of 18 are entitled to benefits on your record. If you have in this case, a disabled son that has been deemed disabled by Social Security before the age of 22, and let's say they're already receiving benefits on SSI or whatever the case may be, then yes, when you file for benefits, then you'll file for DAC benefits, disabled adult child benefits, and they'll get 50%, up to 50% of your full benefit amount. And as a disabled adult child, that is, just regular disability benefits. If your child is receiving SSI now, then for people on SSI, they're not entitled to Medicare, because SSI doesn't pay into Medicare or anything. People on SSI may be able to get a Medicare if they file for Medicaid in that particular state that they're in. Medicaid decides to pay for Medicare for them, so that is a possibility, but they don't get it automatically. But in terms of disabled adult child benefits, not right away, but 2 years. After being on regular Social Security disability insurance, which disabled adult child benefits is regular SSDI, then after 2 years, then yes, they will be eligible for Medicare. And that's definitely, if we're talking about changing things, that is one thing that I and a lot of people, my regular viewers, agree that is one thing that should be changed. If once you start your Social Security benefits, you should automatically be eligible for Medicare. And I've heard through the grapevine that they're maybe talking about making Medicare, bringing back the age. I've just heard this as a rumor, but it's a good rumor. I think we should perpetuate. Reach out to your politicians and say, I heard. I heard a story about from a guy that knows a guy that had a sister that's a cousin that had a neighbor that was maybe heard about the administration, or Dr. Oz, who's in charge of Medicare now, is thinking about starting Medicare for people earlier than 65. Don't know if that rumor is true, but I like it, and let's make that rumor come to pass. So yeah, I would reach out to your politicians and to take advantage of that rumor. And so when people and survivors take their benefits at 60 years old, their Medicare should start immediately. If your son is approved for regular SSDI benefits, shouldn't have to wait 2 years. Should start Medicare immediately. Yeah, I am 100% in agreement with that. If you are, then reach out to your politicians. Yeah. I had a lady call me and she said that I had enough points, which I don't understand, now to get SSDI instead of just what I'm getting SSI. She said she was going to call me back at another time to, um, but never did something. So maybe, so you're receiving SSI, and the reason you were receiving SSI is because of disability. And you weren't, I'm thinking you weren't eligible for SSDI, Social Security Disability Insurance. You're receiving SSI, Supplemental Security Income, but you weren't eligible for SSDI because you didn't have enough quarters of coverage. And I guess you've been working a little bit possibly, and now you are. And as part of SSI, it's mandated when you receive SSI and you're eligible for any other benefits, spouse benefits, divorce spouse benefits, an inheritance, or SSDI, your owner, you have to take it because SSI comes out of the general taxation. It doesn't come out of the trust fund. And in order to take care of the general taxation, make sure you're not wasting money, if you're eligible for any other benefits, you have to apply for those other benefits. So, yeah, so possibly the person that called you up said, hey, we have to get you a claim for SSDI. It's probably, I'm thinking, based on doing this a few million times, it's probably not going to get you any more money. Because if you're just eligible for SSDI just now, barely by the, scrape of your whatever, then you're probably just going to get a very small amount. Like if you get $200 from SSDI, and you're getting $900 from SSI, then what will happen is you're going to still get $900, but you'll get $700 from SSI and the other $200 from SSDI. So I'm thinking, based on my experience, that you're not going to get any more money. However, because you're now going to get SSDI, that also means that you'll be able to get Medicare. So I don't know if you have Medicaid now, but you'll also be able to get Medicare, and you'll have Medicare and Medicaid. And so when your Medicare starts, make sure you reach out to Medicaid and tell them to pay that $185. But the next step is to contact that person, contact Social Security and say, hey, I understand I am now eligible for SSDI. Let's go ahead and get it started. That way, because you want your Medicare, to start sooner. And then you can call chapter there when that starts, and they can see if there's a Medicare Advantage dual eligible plan in your area that can get you some more money or benefits or something. So, yeah. But yeah, first thing, call Social Security and take that SSDI application. Get that done. Be happy. Who can we sue? Anybody for stealing our personal information without our permission? Who would be interested in a class action lawsuit? I am sick of these blatant billionaire thieves. Yeah, I think there's Jamie Raskin, I think, was trying to start that movement about Freedom of Information Act, requesting freedom of information on who was provided your information. When people are in the Social Security system, because knock on wood, Social Security, you hear about Social Security numbers being lost all the time, and this, the computer is hacked and all that kind of stuff. That's never Social Security, knock on wood. That's some credit card company, some financial institution, some hospital or something like that doesn't have strong enough safeguards, and they lose your Social Security number and your date of birth and your name and all that kind of stuff. Social Security has never had one of those big things like that. It's always been some private entity, but now We don't know, do we? We don't know what's the Doge kids, plugged in their laptop and have everything on their laptops. We don't know. So if you do I would start with a Freedom of Information Act and say, hey, I want to know who accessed my record. So that's a start. And then, yeah, I'm sure there's going to be a class action suit out there for someone, lawyers, love to do those. So I put my ex through electrical engineering school. I had his children and supported us. I divorced him 10 years. So now his new wife of 5 years is bragging about getting it. Abusive related. Wow, lady, I'm sorry to hear that. Yeah, you're entitled to that benefits as well, to those benefits. If so, you've been, if you're entitled to those benefits. You're 62 years old, you're at least 62, you're getting benefits on your own record, then you can file for spouse benefits. And I guess the new wife can also get spouse benefits because they've been married, and another ex-wife. It doesn't matter. It doesn't affect your benefit amount at all. Could you imagine if it did? So if you had three exes, and because you know they can only get, when there's three people, the total amount have to be divided by three, so each of those three exes get less. Could you imagine the issues that would happen across the country if that happened? Oh my gosh, that would be unbelievable. Yeah. So Social Security has decided that one benefit does not affect another one. So if you're entitled to up to 50%, doesn't matter. Another X can be entitled to up to 50%. Another X can be entitled to 50%. One does not affect the other at all. You probably heard that there's a maximum you can pay out on a record, but that's for the current in-house family. The family max does not apply for X's at all. So yeah, if you're entitled to benefits on that person's record, you definitely need to file. Yep, absolutely, and get that money. Don't worry about what the new X, former, current, whatever. So trying to get a hold of a local representative or anybody in Washington is like trying to give medicine to a child. Yeah, it's pretty crazy out there, and yeah. So here is a way. Is the switchboard, for your senator and House of Representative? There's the switchboard there. There's the president switchboard. Get on to their websites. Call their local offices. So this is the one back in DC. Those phone numbers are the ones back in DC. Go on to their social media. A lot of these, politicians have social media type thing. So, reach out to them and say, hey, what are you doing to improve customer service, to make sure our checks don't stop, to make sure our checks aren't, cut in the future? And don't give us all this BS about the trust fund was stolen. It was given to Ukraine, or it was given to illegals. Come on. Do you think we're idiots? Well, yes, they do. But anyway, I was married for 9 years. I divorced my ex. He died 4 years ago. Am I eligible for some payments from his SSI? No, unfortunately. You had to be married 10 years. So in an SSI is an entirely different program. But you're talking about just regular survivor benefits. Because you were divorced, no. You had to be married 10 years. There's exceptions on Social Security, but unfortunately, that's not an exception. Well, there is one exception. If you were married to that person for 9 years, you divorced, and then you remarried that same person by the end of the following year, and then were married another year, Social Security can add those two times together, but that doesn't sound like that's your case. Unfortunately, yeah, there's no money there for you. If you were married to the person when they passed away, there is no 10-year requirement. That's only for a divorce. A lot of people miss that. So if you were married to someone and you were married at least 9 months and they passed away when you're married to them, then you're entitled to those benefits. So let's see. Get some other questions. Had period of not having income and then became disabled after a time from improper chemical use by someone. And so my Social Security is so much lower than the gaps due to criminal. Yeah, Social Security, bases your benefit amount, your retirement benefits, spouse benefits, survivor benefits, disability benefits based on how much you actually paid into Social Security. So if you've got years of gaps there, then yeah. For retirement, it's based on your high 35 years of earnings. So people say, well, I've only got 30 years of earnings. What do they do with the other 5? they add in that zero and they divide it by 35. So it does increase your benefit amount. So let's see. My folk said they didn't know to put me on theirs. Later, Social Security say, you look fine to me, denying throughout my life, now in 60s. Folks did, or your parents, I guess. How do I prove anything? Multiple disabilities. Yeah, that's going to be tough. If you already filed for DAC benefits, disabled adult child benefits, and, you know, you look fine to me. Yeah, I'm not sure. But if you went through the entire process and you were denied disability on your parents' record, then I mean, you can definitely try again. And if you had, disability that, started before the age of 22, you're in your 60s now. It's going to be very, very difficult. I've never seen it be approved. I've never really seen anybody in their 60s apply for benefits as a disabled adult child. Because, if you usually when you're in your 60s, you have a work record based on your own work, unless you never worked since you were before the age of 22. If you've never worked, then it would be, more plausible. But if you worked after the age of 22, then then it's going to be pretty much impossible to get disabled adult child benefits because you worked. Okay, there's a follow-up on that one. Christy, the one in our local office has a guard. He is very rude. He acts like you've committed a crime for walking in the door. Yeah. We used to have our guy, Moi Moi, big Samoan dude. Yeah, scary as looking dude, but yeah, giant teddy bear. So sometimes they look scary, and they got that look on their face, but yeah, they're softies. But if that person is rude, then I would contact for Federal Protective Services. Yeah, you contact it's Federal Protective Services. I'm trying to figure out where you just have to Google Federal Protective Services, and then then you can find the company that they work for, and and report them and say, hey, this person, we've had several guards in our office be fired for not doing the right thing. Yeah. And some guards, we're definitely not doing the right thing. Live discharge in office and all kinds of, So anyway, yes, I did say that. I was married for 9 years. I divorced. Okay. Okay. I already answered that one. Let's see. Literally can't walk for 10 months. Need another surgery. And they've denied me twice. But if I somehow find a job that I can do, now they'll be sure to garnish towards this program that refused to help. Yeah. Remember, if you apply for disability benefits and, because you're unable to work and you're denied, remember you've got that appeals. So you can file for, appeal the request for reconsideration, and then, see administrative law judge. So just don't stop at, the first denial. Keep going. Let's see what else here. Oh, James, thank you for the donation. I appreciate it. You are too awesome. In this environment, how many months do you need to file prior to 66 and 10 months? It's always the same. You can file 3, sometimes 4 months, depending on what day it is, in advance. You can't file any earlier than that because Social Security can't hold it on the system, regular retirement benefits or something. But in this environment, normally, it's been getting, the staffing is getting bad, for a long time, but it's even worse now. So I say use every day possibly. So normally I would say, a month or 2 before it should be good. But now I would take it to the limit and try it 3 years ahead. Or excuse me, 3 months ahead. The sky was never in the Marine Corps. The sky was never in the Marine Corps. Okay. So I guess the Marine Corps was subterranean force now rather than a forward deployed force. Anyway. Anyway, if the start of my Medicare gets delayed due to staff shortages, can I continue to stay in my ACA health insurance? Well, technically you can stay in your ACA forever. But you'll lose your subsidies and those cost sharing and stuff because you're eligible for Medicare. So if you're willing to pay the full boat, you can actually stay in ACA. So you'll just lose all the subsidies and the premium tax credits, as they call it. But that's why I would say, start that process, reach out to your politicians and say, hey, because of my situation, I didn't have time to plan signing up for Medicare, the 1 or 2 or 3 months because my company just shut down. I got torqued at my boss and I just said, take this job and, whatever. And I lost my health insurance immediately and I need Medicare to start next week, 2 weeks, from now. And I can't get in the office and I need my pills. So you contact your politicians and hopefully they will do something. Yeah. Or, yeah. 10 years of marriage and at least 62 for filing benefit is someone has work history. Okay. Let's see. Test channel asks if my spouse files early and then files for spouse benefits after I file at 70. Will the Social Security calculate take half of my full retired amount and reduce it by the same percentage as her original reduction, or will Social Security use my full FRA? Okay, all right. So test channel, you're testing me. Okay, so let's say your spouse files at 62. So let's say she uses files at 62 on her own record, and then the benefit amount that they will use is your full PIA, your primary insurance amount, not your PIA with your DRCs, not with your delayed retirement credits, because you're going to file at I know you're not going to file after 70. You're going to file at 70, because your benefits don't increase after 70. But spouse benefits are based on your full retirement age amount, not how much extra you get after that with those delayed retirement credits, or not if your reduced amount. It's at your full benefit amount, your PIA, which is your benefit amount at your full retirement age. And if your spouse files at 62, then that's reduced just like everything else. So her benefits will be reduced and the benefits will be reduced on your record. One offsets the other. So, yeah, but they always look at your full FRA amount. They always look at your full retirement age amount. So, Social Security tax comes in the form of payroll tax. That's what you pay into the system from working. That is correct. Yep. So FICA payroll tax, same thing. FICA is the 6.2% for Social Security and then 1.45% for Medicare. And then obviously, your employer, or if you're self-employed, you pay the other part as well. So let's see here. Terry, what's up, Terry? My 89-year-old mother lost her Social Security card. She is in a wheelchair and a nursing home. Is there any way to get her a new card without having to take her into the office? I mean, why do you need one? Is she going to get a job? Does she have to show her Social Security card or something? If, she doesn't need to show it, then I wouldn't waste time. The Social Security is actually coming out with an electronic, digital Social Security card, which I think is a good idea. And they're supposed to be rolling out in the summer. So you don't even need the paper card anymore. There'll be a digital version of that. So hopefully that goes well. Yeah, if you are, if she definitely 100% needs it, she has to have it at the funeral, or excuse me, the nursing home, or whoever says that she needs it, then I guess you need it. So you just download the SS5, which is the Social Security card application, SS5, and you get her proof of proof of ID, like if she has a passport or a driver's license or something like that. You can actually take it down. You can take it down to Social Security, and give it to them. Give them the SS5, and then give them the passport or the ID or whatever, and they will make a copy of your original document, her original document, and then stamp it and certify that it's an original document. They have to make the copy. Don't make the copy. They have to make the copy because they have to see the original. and then they will send her a card in the mail. So that way, yeah, she doesn't have to go down there, because you can technically mail a Social Security card application. You can fill out the SS5, put in your passport, driver's license, and mail it to your local office. And you can do that if you want. But I, if you're able to go down, I wouldn't trust it, being in the mail and your original documents getting back. Yeah, in my office, about once every 3 or 4 years, somehow people send in like a certificate of naturalization or something like that, and then it gets lost somewhere. We never figure it out whether it never got to us or whatever. We would have to pay to replace that certificate of naturalization. So if it looks like we did get it and we somehow it got lost, or when we returned it, it went to a different, we never figure it out. But if it's beyond a reasonable doubt that, it was our responsibility, then the Social Security office will pay for the certificate of naturalization to replace it. And those things are crazy expensive. So several $100s. So, all right. We got people in here. People from Russian chatbots or something. Pink Cow, hit the like button, subscribe, share, hit the notification. To all you, thank you. Yes, appreciate it. You're too awesome. They have found over $1 trillion in fraud from the previous administration and the government. You can go to Doge government and see everything with your own eyeballs. Yeah, no, they haven't. Sorry. Yeah. I've been on to, and they made it more difficult. Before, in the Doge wall of receipts and X, you could go in there and you could, click on the topic, you can click on the agency and it will align it, alphabetically, and you can look. And now you can't do that anymore. So they're making it more difficult to look. But if you look at, they haven't found they haven't found $1 of fraud in Social Security, and which is crazy. There is fraud, but it's not the type of fraud they're looking for. The whole, 20 million people over 120 years old. Yeah, they found out that, guess what? They're not paying any money to those people because they're not on, the database. I came up with a good way to explain it. The database of those 20 million people is called the Numadent. Where you get paid is called the MBR. It's a completely different record, and those records have been terminated, suspended, whatever the case may be. Sure, this record over here is not all pretty and stuff like that, but this record over here pays zero money. It's kind of like when you go to a restaurant and they ask for your credit card to slide in a little thing, pull out your driver's license and slide it into that little thing. And I think you're still going to owe the bill. So the Numadent, that those Social Security, supposedly 20 million Social Security cards over 120 years old that haven't been closed out, yada, yada, yada. Again, there's no money coming out of that. That's like going into a restaurant and using your driver's license in the credit card slot. So, but yeah, it's just another attempt to attack Social Security so they can privatize it. And we keep falling for it. Yeah. Particularly, what was his name? Yeah. Roscoe keeps falling for it. Have been initially approved for SSDI, but it was pulled for a random QA check on 2/28, which said it should take 15 to 30 days. It is going on 60. Should I be worried? Yes. Those, it's not you, the Quality Assurance Office, because when you file for disability, you file to your local office, Social Security office. They do everything, and then they, put the package together and they send it to the DDS, the Disability Determination Service in your state, the state agency that does the medical determination. And then once they're done, they send it back to your local office for processing, final processing. Along that path, sometimes quality assurance, they grab ones at random. And unfortunately, you're Mr. or Mrs. Random. And so they grabbed yours to look at it. And sometimes it's just a, small little technical type thing. And, oh, you forgot to check this box and that box, and they send it back and the person checks that box and then it's all cool. Yeah, so you got randomly pulled. But here's what I've seen is sometimes when quality assurance grabs it and they see something that needs to be addressed and they send it back to DDS, somewhere along the lines it gets misplaced, rerouted, not got to the right person or whatever the case may be. And it kind of falls through the cracks. or falls through the cracks being returned to SS. So I would call. I would call the DDS, your state disability determination service, and ask and say, "Hey, my claim was just approved or just decided, and I want to find the status of it." And the claims examiner at the DDS will say, "Oh, here it is. Oh, it looks like quality assurance sent it back to me because I needed to check this. Oh, okay, I'll check it right now, and then I'll send it back, and it should be good." So yes, I would do that immediately. Yes, please do that immediately. All right, let's do. Oh, we're over an hour here. Let me do one more question. I don't think I should have picked this question because it looks too long. But anyway, let's try it. Please discuss or link repaying or suspending Social Security benefits from one who took recently age 65 and turned 66 this year. Okay, so your call, yeah. I'll link to make it easier. But it's basically what Mark is asking about is voluntary delayed retirement credits. So if you're receiving Social Security benefits and then you are approaching your full retirement age and you want to suspend your benefits so you can get those delayed retirement credits, you can do that. And delayed retirement credits are 8% every year. So what you do is you contact Social Security and say, "Hey, suspend my benefits, and then I will start those up later when I turn, 68, 69, 70, or whatever the case may be. And so I can get more money when I turn 68, 69, 70. So that's the benefit of that. And I just put the link because unfortunately, when you call Social Security, particularly new people and people at the front windows, not many people do this voluntary delayed retirement credit thing. So when you call, Social Security employees will say, "You can't do that." And you just have to ask, "Okay, can I speak to a Title II CS, Title II of the Social Security Act," which is, I was a Title II CS before I became a manager. And yeah, then they'll say, "Yeah, okay, yeah, you can do that." And then I just put the reference in there too. So it's, I put the link in there, VDRCs. I put the link in there. I should actually put that one because that's one that says asked. I'll put that in my YouTube description, yeah, as well. But there it is. All right, we are over an hour, and I apologize for all those questions I couldn't answer. Oh, and I forgot to mention, sorry, Chapter. Yeah, they sponsor this. Live Q&A. So if you need any help with Medicare, make sure you reach out to them. Sorry, Chapter, for ignoring you today, but you guys are awesome. You don't care if I mention you. Yeah, so that's awesome. You just help as many people as you wanted, and so they're cool about that. So please, yeah, call them up if you need help with Medicare. All right, y'all take care.